advocacy surrounding smoke-free protections in New York City is more important than ever right now. So Deidre, are you ready to share your screen?
Yes, I am. Let me see if I can do this properly. Can you see?
Yes, we can see.
Okay. All right, so thank you for having me. As Kim said, my name is Deidre Sully. I'm the director of NYC SmokeFree. And what we do is tobacco control advocacy in New York City. We're a program of public health solutions, and we've been around for the better part of 20 years. And we pretty much try to make that we're staying within the zeitgeist of tobacco control and monitoring health disparities and how that relates to tobacco disparities in New York City. So I don't want to get too much into the particulars of vaping. I think we heard some of that, and I think we'll get some of that from some of the other presenters. But I do want to just reiterate, we do some of the facts, and we do know that smoking and vaping, can lead to compromised lung function. And we also know now that those things are also risk factors for COVID-19. How that relates to tobacco advocacy is making sure, part of our job is making sure that we're doing a lot of the education at the community level with both adults, influential people, especially young people, and making sure that people understand the dangers thereof and the particulars that come with those dangers and some of the nuances. One of those being flavors. And I'll take you through really quickly. We've recently had some wins in restriction on flavors. So just recently, New York State's flavor ban went into effect on May 18th, and New York City is not far behind. On July 1st, the flavor ban, that's a typo, yay, flavor ban will go into effect on July 1st. And those flavor bans are important because it includes all flavored e-cigs, and they did include menthol in those e-cigs, mint and wintergreen and menthol flavors. We do still have some work to do in our state and in the city, where we have to make sure that we're doing a lot of the education and making sure that people know the dangers of menthol with traditional tobacco products such as combustibles. One great win today was in Massachusetts. They passed their flavor ban today, and it actually included mint and menthol and combustibles, and I believe they're actually the first state to go that far. And so I want to just go a little bit deeper into why flavors and paying attention to that is really important. And it's because flavors hook kids, plain and simple. That is the initiating thing that gets young people to start smoking, whether it is use of e-cigarettes and vaping or combustibles. And one of the main flavors is mint and menthol. Yes, we know that the fruity flavors for the e-cigs were the most popular, but the second runner-up was mint, and menthol is a part of that. Menthol is a derivative of the mint plant, and the reason why it's used in tobacco products is because it gives a very false sense of safe smoking, where it numbs the throat because of the cooling sensation that mint has, and so it masks the actual harshness of the tobacco going down. And so when you are a new smoker, or which is usually a younger person, it helps to initiate that person or the young person into smoking. And the problem with that is that it makes it very, very difficult to quit. We already know that tobacco use is an addiction, and the addition of a flavor like menthol makes it even that much harder for people to quit. So one way that we at NYC SmokeFree at Public Health Solutions are really trying to combat that is through media. And so we currently have a media campaign going on to help to educate the public about this issue, because as I said, more work needs to be done. We've had a lot of great wins over the last couple of months and couple of years when it comes to tobacco control, but there's always something that needs to be done because we have an enemy that is very crafty. Big tobacco always has something up their sleeve. So I just want to give you an example of the campaign that we're running right now. And this is very, very important because as I said, menthol is the initiating flavor. But one of the more things that is sinister about menthol is that it actually, more Black people use menthol. So Black smokers, people who smoke that are Black, they use menthol at a rate of 85%, a little over 85%. And this is not a mistake. This is very much on purpose. And a lot of this comes from marketing tactics. And we know that that is the same tactics used when we're talking about e-cigs. So marketing is a very, very important tool that the tobacco industry uses to sell their product, obviously. One thing we want people to know is that, though, this product, when used properly, it most likely will kill you or make you sick. So it's really important to get out the message about menthol and its effect on young people and people of color, specifically people in the African American community. And especially as right now, when we're seeing the effects and the disparities and public health disparities of COVID, and people of color are dying at higher rates, what's happening to those people who are smokers? So it's really important that people have the facts and have some understanding and some awareness of the importance of knowing why flavors in tobacco are a danger, and particularly menthol. That being said, we are also running another campaign to keep people informed about what's going on in tobacco. And this is really important because as phrases like shelter in place and social distancing become part of our everyday vocabulary and our everyday language, things like issues like smoke-free housing really need to be brought to the forefront. So smoke-free housing and increasing the amount of units in New York City that are smoke-free is part of a part of our work. And we, move through New York City in all 5 boroughs to work with landlords, property owners, sometimes tenants, to really give them information and help them bring their buildings smoke-free. This has now more than ever become something that's moving to the forefront because people are now in their homes more. Before, people are out at work, and something like smoke-free housing may not seem like it bothers you that much. But when now we're sheltered in place and we're kind of on a lockdown and mandated, to our apartments and there's really nowhere to go, people are really noticing how much shared air that they're using with their neighbors, and how a neighbor that smokes or chain smokes can really affect your family negatively. We know that people are at home. Some people have lost jobs. One thing they don't need is medical because they've now been exposed to secondhand or thirdhand smoke from someone that lives in their building. So we are definitely running this campaign to educate people on the need and the importance of smoke-free housing. I put a little description on the screen, hopefully that you can see it, of the ad that's running. Maybe you've seen it over your Instagram or Facebook or Twitter, because we want to make sure that we're getting to people where they are. And as we're all home, we know that people are on their computers, on their phones. So this is, we thought that this was a really good medium to reach people in that way, in a really big way. And also just an example of some of the feedback that we get even on Twitter when it comes to our campaign. It's really striking a chord with people, as is the menthol as well. People are really noticing, as I said, how staying at home and sheltering in place really affects their health and how they're exposed to tobacco smoke. And that's really the same as it goes when we're talking about social distancing. As we're looking at states and New York City, talking about reopening and people moving around again, we see that there are a lot of instances where people are waiting for food in bars and restaurants that are, kind of semi-open or at least allowing takeout. And especially as the weather is getting warmer, we've been cooped up for most of 2020. And people want to get out. So what happens when you have people who are addicted, they use tobacco and they are addicted, and everybody's out on the street? What happens when we're trying to social distance and they're smoking, and people are now being exposed to secondhand smoke? So one thing we want to make sure that we're doing is continuing to work with community organizations and things like BIDS and businesses in New York City to show them how important it is to establish tobacco-free outdoor air policies for their businesses. And we know in New York City, that is a very really big feat because, you know, space is at a premium. So your outdoor space may just be your front door. So that's why it's important to talk to all of these places and make sure that they all understand and there's an agreement. You know, one thing that we've all been saying through this is that we're all in this together. So we should all be in this together and make sure that we are eliminating secondhand smoke and making sure that we have people's public health at the forefront. And I just wanted to, and so my presentation was very quick. I just wanted to share this with you as like an example. So this is an article from Eater over the weekend when we had that really warm weekend, and you can see how people are very clustered, like social distancing becomes like a, what's that? So we want to make sure that, you know, as people are, you know, trying to come back out and social distancing or not, that they are at least not having to be inundated and bothered with secondhand smoke. So in a nutshell, that is NYC SmokeFree. You know, tobacco advocacy, especially in the time of COVID, is really, really important because it's bringing a lot of things to the forefront. And we want to make sure that people's public health is number one.
Thank you so much for that outstanding presentation. And thank you so much for all your help, Deirdre, in planning everything. There's a few comments in the chat room, and please do send in some more questions if you have them. One question says, thank you so much for this presentation, Ms. Sully. On average, what age do African Americans start using menthol? What can we do and or can be done to prevent the population from being attracted to menthol?
So on average, and I will give a general, it's really young people, regardless of race. The average age of smoking in New York State, smoking initiation is 13. Okay. And so one of the issues around menthol, a lot of people will say, well, I started smoking because my mom smoked or my dad smoked menthols or my aunt smoked menthols. But one thing that we know that's a fact, the tobacco industry has a sordid history of marketing in Black communities, you know, using celebrities, very much of the same tactics that they do now, sponsoring shows. One very sinister thing is really infiltrating historically Black organizations such as civic organizations, schools, and the like, you know, paying for buildings and things like that in an effort to, you know, make sure that they have an ally in the Black community. So it's really is initiation is kind of general with, you know, 13 being the age in New York City, but there at some point, yes, there is a kind of a break off where Black people will continue to smoke menthol.
Great. One person wanted to help volunteer. I'm sure there's many other people on the webinar who would love to volunteer. So would they contact you directly at this email, I assume?
Yes.
Okay, perfect. And then can you say the two remaining questions and then we'll move on. But again, we're going to have a question and answer period at the end. Can you say a little bit more about secondhand smoke, and does that include vaping, and what can be done to help children from vaping?
So right now, I don't believe there's any data. Maybe one of the other panelists may have something to say about this on secondhand vaping. Right now, a lot of our education is talking about how dangerous it is to the actual person that's using, because we know that there are different chemicals, just like there's chemicals in combustibles, there's chemicals that can really harm the lung. You know, truthfully, we shouldn't be inhaling anything but oxygen. So, so I don't have like any information on secondhand vaping, but as studies are going, I'm sure we will have some information. You know, the jury is still out on whether e-cigarettes and vaping is harmful or harm reduction. But as tobacco advocacy and public health person, you know, it's important that we err on the side of caution, because we do know the history of, you know, tobacco was marketed by doctors and nurses a lot of the times. And then 50 years later, we had the Surgeon General's report, you know, revealing that it actually is bad for you. So we don't want to have another incident like that.
Great. And maybe then in the question and answer period, we can talk a little bit more about school children. But thank you so much for that presentation. That was fantastic.